name is Carolyn Ahern, and I am a physical therapist here at Les Cruces Comprehensive Rehabilitation and Home Care. I have been a physical therapist for the last almost 15 years, and today I'm going to talk to you a little bit about TMJ therapy. So most people come in for TMJ treatment because they have jaw pain, and they say, oh, I have TMJ. And that's really a little bit of a misnomer because we all have a temporomandibular joint. And so really what we're talking about is dysfunction in that joint. And so we generally refer to the treatment as TMD, or temporomandibular dysfunction. So in general, there's two main reasons why people have issues with TMD. And one would be direct impact or problem within the joint space itself, and the other being increased muscle tension or restriction in the connective tissue or muscles surrounding the joint. A lot of times the common complaints that we hear are, I have clicking and popping in my joint, I have joint pain, I bit into something and now, my jaw, it really hurts. There's grinding or grating, or headaches or ear pain, sometimes ringing in the ears, headaches, or even pain in the teeth. And all of these things can be related. So when we look at therapy for TMD, we need to look at a variety of things. And so the first thing we do is a complete postural assessment. We need to make sure that everything in the spine and in the pelvis is balanced. So that way when we get to the head and the neck, we can really see that those things line up the way that they're supposed to. In addition to posture assessment and some education and modalities and manual therapy exercises and those types of things, we also do what's called microcurrent point stimulation therapy. And this is basically kind of akin to a functional acupuncture type treatment where we have two little devices and they have a little point on them that has microcurrent, and we place them on the muscles or trigger points to help relax the muscles, decrease any overactivation in the nervous system, and it also releases endorphins, which kind of helps with pain management. So we incorporate that into treatment. We also incorporate surface EMG of the masseter muscles. So our masseters are muscles here. They're muscles that we mainly use for talking or chewing. They are the muscles that, if we're clenching, are probably the most likely culprit. And so we actually have a machine that we set you up on with some pads here that can tell us what those muscles are doing. And so what we're really looking for is, can the client relax those muscles? Do they even know that they're overworking or not? So again, it's a biofeedback type of training that's really helping us to change habits. And then the third thing is we've been incorporating our capnotherapy, which is another biofeedback tool that looks at breathing strategies. And so when people have headaches, or they have chronic pain, or especially pain in the jaw or in the head, which you can't get away from, they tend to change their breathing patterns, and this can lead to dysfunction, which can cause all different types of symptoms, including the headaches and increased muscle tension themselves. And so we want to figure out what are the triggers for that so that we can make sure that we can incorporate that so the person can learn to self-regulate some of those behaviors that they've learned over time, so that ultimately you get the best benefit of therapy. So if after listening to this you realize that you have this jaw pain, headaches, neck pain, you're grinding or you're clenching your teeth, we would love to help you.